Hi, everyone. This is October, which is Breast Cancer Awareness Month. And with this in mind, I wanted to speak with all the women out there and talk about breast cancer prevention first, because prevention is really the best type of medicine. As you all know, self exam is really important in women, and it's really important that you do that once a month in the shower. We'll talk about breast exams later on in a different clip. Um, in addition to self exams and going to your OBGYN for examinations at least once a year, please do your mammogram starting at age 40. There have been some discussions in the past 10 years, particularly from the FDA, in regards to not overdoing mammograms because they're worried about false positives or finding abnormalities on mammograms, which would concern the women and then lead to more testing, which is not very useful. But I'm still a big advocate in having your annual mammograms starting at age 40, in addition to your examinations with your OBGYN. If you do end up having an abnormality on mammogram, please follow up with additional tests, which are usually indicated or requested by the mammographers. And this might be an ultrasound, an MRI, or even close up images on other mammograms. Um, One of the most common questions that comes up in my practice is, what if I have a breast implant? Does that interfere with the diagnosis of breast cancer? And the answer is no. Studying millions of women who have had breast implants in the past, having a breast implant doesn't interfere with the diagnosis of breast cancer. It can make the studies or the mammography a little bit more complicated because they might have to do other tests and other angles, but it's perfectly fine. It should also be highlighted for you all that if you do have a breast implant, it's important that you have an MRI every 3 to 5 years just to be sure your implants are okay and there are no fluids around your breast implant. Because in women who've had breast implants, it's not only breast cancer that they get, but there are incidences, although very rare, a strange cancer within the breast, like a lymphoma, which usually presents itself with fluid around the breast implants. So, if you notice redness at one breast versus the other, slight enlargement in one breast versus the other, or even one breast changing in any way, please come in. We'd be happy to examine you here in my office, and we can order any tests that are necessary to try to see if, God forbid, it's breast cancer. Thank you.